Okay, let's take a look at case number 10. A 3-year-old boy is brought to his pediatrician with a fever, tachypnea, and a cough productive of rusty sputum. He has a history of recurrent lung and skin infections. He has had several fungal infections of his skin, as well as an abscess that formed where he scraped his arm. An X-ray of the chest shows a normal thymic shadow, but some hilar lymphadenopathy. Further questioning of the parents reveals a maternal male cousin who died at 5 years of age from severe pneumonia, and a maternal uncle who has had 2 surgeries for intracranial fungal infections. What is the most likely diagnosis? The most likely diagnosis is chronic granulomatous disease, or CGD, an X-linked inherited immunodeficiency syndrome. The patient is predisposed to bacterial and fungal infections. The normal thymic shadow suggests normal T-cell maturation, which effectively rules out a diagnosis of severe combined immunodeficiency, or DiGeorge syndrome. The strong family history of male involvement on the maternal side indicates X-linked hereditary condition and suggests CGD as the likely diagnosis in this patient. Infections in which organisms could be particularly severe and problematic in this patient. Patients with CGD are at risk for serious infections with catalase-positive bacteria, including Staphylococcus aureus, Aspergillus species, and Burkholderia cepacia. Why are patients with this condition especially susceptible to catalase-positive organisms? Reduced nicotinamide adenine dinucleotide phosphate, or NADPH oxidase, which is required for production of reactive oxygen species, is deficient in patients with CGD. The radicals are used by neutrophils during the oxidative burst to kill engulfed organisms. Mainly bacterial species make free radicals as byproducts of their metabolism. These free radicals contribute to the toxic environment in the neutrophil lysosomes. However, catalase-positive bacteria such as Staph aureus can neutralize these free radicals, leaving the patient unprotected against these organisms. The primary method of host immunity is containment of the offending organism, leading to numerous granulomatous formations. What laboratory test can confirm the diagnosis? The nitro-blue tetrazolium test can detect the presence of a respiratory burst in neutrophils. In normal individuals, the test is positive, but in patients with CGD, the test is negative because the superoxide free radical is not produced. What medical treatments are available for this condition? Infections must be treated aggressively with appropriate antimicrobials. Trimethoprim sulfamethoxazole can be used as long-term prophylaxis. In addition, interferon A and immunomodulator. An immunomodulator is used in patients with CGD. What therapy or procedure provides a definitive cure for this patient? Bone marrow transplantation provides a source of functional neutrophils with the ability to create oxygen-free radicals to effectively kill organisms engulfed by phagocytosis.